I guess for me, it pointed out the urgency for all of healthcare providers to begin to really take seriously the kind of transformation and the integration that's going to have to happen. I mean, this is reality. I don't see there's any way of going back or any way of avoiding the consequences. And if this commission recommendations aren't voted in this second phase, then there are automatic reductions taken out of healthcare, Medicare,
right,
over which there'll be no vote or no choice. It will be automatically invoked. I mean, that's frightening because that's 3 or 4 months out.
Yeah, I think from the healthcare provider perspective, this is more of the same, just more pressure on the overall cost of healthcare in the U.S. and its huge impact on the economy. Mm-hmm. Whenever I think of this sort of thing, I can think of the pressures on hospitals and physicians, hopefully cooperatively, hopefully working together, are looking for better ways to deliver safer, higher quality care at a lower cost.
Well, to me, the important thing is, even with all these cuts, we're going to have enough money to deliver the very best care in the world. But we can't deliver it like we've been doing it.
Right.
The traditional fee-for-service, which is reinforced by Medicare regulations, is a big part of the problem. But if we can move to a different model that integrates care and puts physicians and hospitals and insurance companies working off the same page, I think we can do really good things in this country.
There is enough money. There's not enough money to do it the way we're currently doing, but there is enough money to do some wonderful things. And as the leadership of the healthcare industry, you kind of keep going day to day from thinking about your short term, how do we get your monthly statements out, all that kind of thing, and longer term, moral obligation of leading and doing the right thing for your community, and we've got to figure out how do we do both at the same time.
It's going to be interesting to watch us as we move from silos of care for pharmacies and physicians and hospitals to an integrated system, and primary care becomes essential, hospitals become less essential maybe in the scheme of things. I personally think it's going to be wonderful for patient care. I think it's going to be wonderful for quality and inclusiveness of the patient in the entire episode of care, and I think it could save a lot of money. I think the end results will be the right thing to do, but I think it's going to be extremely painful, maybe even absolutely destructive to certain pieces of the system.